Now we'll see about the white matter of the cerebrum. White matter of the cerebrum are, it means they are merely the fibers that are connecting the different regions of the cerebral cortex and form a large volume of the cerebral hemispheres. And there are three types of fibers, that is association, commissural and projection fibers. Association fibers are the thing that are connecting, they are also known as intrahemispheric fibers. Intrahemispheric means they are connecting the regions within the same hemisphere. For example, there are two types, short and long. Short association means they are connecting the adjacent gyri, and long association means they are connecting the widely separated gyri. There can be examples, that is uncinate fasciculus, superior longitudinal bundle, and inferior 2 or 3 is needed. And commissural fiber means they are the fiber. In this figure we can see commissural means the example or the most important thing is corpus callosum, that is it is connecting the different cerebral hemispheres. In the different cerebral hemispheres they are connecting the identical regions of the different cerebral hemispheres. That is a green thing is a commissural fiber. So the most important thing that we have to know is corpus callosum. Corpus callosum means it is a type of commissural fiber, and that too it is connecting the neocortex region of the two cerebral hemispheres. And we will see the parts and the external features. So the corpus callosum is having 4 parts: genu, rostrum, trunk and splenium. Genu means it is an anterior portion, that is the anterior region of the corpus callosum, and it is 4 cm behind the frontal pole, and it forms the forceps minor. And that too, the other thing, very important thing that we have to keep in mind is that the corpus callosum forms a roof of the lateral ventricle. Therefore, genu can be considered as an anterior boundary of the anterior horn of lateral ventricle. Then we have splenium. Splenium means it is a massive posterior region, that is 6 cm in front of the occipital pole, and it can form forceps major. Next thing is rostrum. Rostrum means it is an elongation of genu, and trunk means it is a major middle bulk between the genu and splenium. And the arterial supply are anterior cerebral, posterior cerebral and communicating arteries. Then the clinical anatomy that can be referred here is split brain syndrome, where the corpus callosum is congenitally absent. And other examples of commissural are anterior and posterior commissure, you can just refer there. Then projection fibers means they are connecting the cerebral cortex to the subcortical centers, that is of the other regions of the CNS. It can be of two types, that is corticofugal and corticopetal. Corticofugal means from the cerebral cortex to the CNS. Fugal means away. So from the cortex to the CNS. Petal means from the centers CNS to the cortex. So that is the thing. Projection fibers, the major projection fiber is an internal capsule. So we will deal in detail later. In this figure, when we see this is association, this is the commissural, and this is the projection fibers. Examples: internal capsule.